Hi guys, welcome back to Eduate channel. Today we will be discussing a simplest classification details about the antibiotics. So we know that based on several mechanisms of action, antibiotics are classified. So we will be having a doubt like which all are the protein synthesis inhibitors, which all are the cell wall synthesis inhibitors, which are the so all we are having doubts on the classification. So this is a simple classification details. So you can easily go through this and you can easily share it in your brain by using the simple mnemonic. So let's go to the video. So there are many types of classification present in different books, like in medical books, veterinary books, etc. So we will be classifying them into four main class based on the mechanism of action. So the first one is protein synthesis inhibitors. Second one is cell wall synthesis inhibitors. Third one is cell membrane damaging compounds. That is the antibiotics which act on the cell membrane and produce many problems in the cell membrane. The next one is internal metabolism disturbing compounds. So there are many compounds that disturb the internal metabolism of the bacteria and stop the growth and reproduction and replication of bacteria. So these compounds belong to the internal metabolism disturbing compounds. So actually the main protein synthesis is an internal metabolism, but protein synthesis inhibitors are very famous and we have to classify them and study a lot of details about them. So they are classified as mainly protein synthesis inhibitors. So let's move into, so the first one is protein synthesis inhibitors. So the main compounds are aminoglycosides, tetracyclines, macrolides, chloramphenicol, that is actually nitrobenzene derivatives, oxazolidinones, lincosamides, streptogramines. So by using the first letter of these compounds, I have made a small mnemonic, that is ATM close. So E is nothing. E doesn't have any role here, but to become a proper mnemonic, I have added the E. So the code for protein synthesis inhibitors is ATM close, that is aminoglycosides, tetracyclines, macrolides, chloramphenicol, lincosamide, oxazolidinones, and streptogramines. So this is the code for protein synthesis inhibitors. So the next one, that is the cell wall synthesis inhibitors, the most prominent one used in the field. That is actually penicillins, cephalosporins, monobactams, and carbapenems, which is togetherly known as beta-lactam antibiotics because they have a common ring, that is beta-lactam ring. So and glycopeptides, polypeptide, and cycloserine. So this is beta-lactam antibiotics and this is a GPC. So we have a mnemonic that beta GPCR. Actually, the GPCR means R is nothing. So R is for getting a proper mnemonic. GPCR actually what? They are the receptors. And beta receptor is actually a GPCR, right? So you can connect it accordingly. Beta GPCR. Beta is a GPCR. It is a fact. And also you can use it as a mnemonic for the cell wall synthesis inhibitor. See the cycloserine. So you have seen the cycloserine here also. See cycloserine. Cycloserine actually inhibit the cell wall synthesis, but sometimes it has a role in protein synthesis inhibitor action. So it is included in both, but mainly it is a cycloserine is cell wall synthesis inhibitor. So the mnemonic is beta GPCR, GPC and R. This is simply this R and beta is beta. Beta this beta. So the third one is the internal metabolism disturbing compounds. So the first one is folic acid synthesis inhibitors. Folic acid needed for the bacteria for the production of purines, pyrimidines, DNA, etc. So if you are giving these compounds, the folic acid synthesis will be inhibited. So they are sulfonamides and diaminopyrimidines. The next one is DNA topoisomerase or DNA gyrase inhibitors. They are actually the quinolones and the fluoroquinolones. Next one is RNA synthesis inhibitor. This is having a class ansamycin class. So the rifampicin or rifampicin, both are same actually. So they are belonging to the class as ansamycin. Next one is DNA structure damages. That is actually the damages. We don't have a term like that damages, but it is simply the drugs which damage the DNA structure. So they will be acting on the DNA and producing many misfold and misreadings in the DNA structure. They are actually belonging to the two class, that is nitrofurans and nitroimidazoles. The metronidazole and timidazoles are belonging to the nitroimidazole class, and furazolidone and nitrofurantoin is belonging to the nitrofuran class. So the next one is cell membrane damaging compounds. Sorry for the spelling. Compounds. Cell membrane leakage. They attach to the cell membrane. They produce some porine-like structure. Through that, they change the ionic metabolism. This leads to the death of the cell. They are actually polypeptides, lipopeptides, and polyaids. So the miscellaneous agents, they are the novobiocin, thiamulin, methenamine. So these are the other three drugs mentioned in MSV 2016 curriculum. So in pharmacology. So other all drugs are coming in these categories. So these were the other three drugs. Thank you. If you're having any doubts, you can go to the comment section.